The plan is for you to understand how to structure your proposal effectively. So that includes what makes a good proposal, but also recognizing what are the potential weak spots of an application and how you can address them before putting your proposal together. So this includes some of the common challenges and feedback points that we typically do issue from time to time, and we see the same problems come back time and again. So we really want to highlight that in this webinar so that you are well prepared when putting together your application. And of course, as I said, you'll have an opportunity to evaluate a mock application yourself later in the webinar. All right, so at this point, I'll hand over to my colleague Guy to take over. Thank you.
Hi, thanks very much, Desh. Yes, welcome everyone. I'll just give a really quick overview about PRUK. So I'm Guy Parker. I'm the Chief Executive of PRUK, so work with Desh. We are a small charity, but we fund research across a range of issues, and we have a mission to try and support pharmacy professionals in their research careers. We do that through our own funding schemes and often through partnering as well. So we have a lot of partners, and we're always looking for, so if you ever come across an organisation that may want to partner with us and also is committed to supporting pharmacy professionals to get involved in or progress their research careers, then yeah, please do get in touch with us. As you'll see from the slide, we have recently passed the £2 million mark that we've committed to research funding since we were established. And we are a member of the Association of Medical Research Charities, so that means we adhere to a fairly strict guidelines as to best practice as to how we assess and make our funding awards. So, you know, if you receive a PRUK award, then you've gone through a very rigorous assessment process to actually reach that point. Move to the next slide, Desh. So yes, so we have a research strategy which you can find on our website, which has themes where within which we tend to fund research. You will see from these that they are, in fairness, pretty broad. So generally speaking, if you are a pharmacy professional looking to do some pharmacy practice research, you can probably fit in the research you want to do within the themes that we have. But they're set out for you anyway, just to give a sense of the areas that we like to look at. We do try and review these from time to time, just to make sure that they are up to date and make sure there's nothing new that we particularly want to add in. And we might occasionally have specific themes within calls as well. Obviously, particularly for our partnership awards, that will be the case, where if we're partnering with the College of Mental Health Pharmacy, for example, obviously for that award we have a specific focus around mental health, where we've partnered with particular charities, so Diabetes UK or Kidney Research UK, for example, are organisations we've partnered with. We obviously have a specific focus of around their area of interest as well. But any application to us, you'll see, will fit broadly within the categories we've set out there. Yeah, quick run through of how we work. So we have 3 members of staff, so we are a small charity, and then we have a governance structure around that to make sure that we're working effectively and making the best decisions we possibly can. So broadly that comes in 2 areas. So we have, yes, our board of trustees, and they are essentially the overall responsible body for PRUK to make sure that we are sustainable, manageable, that we're delivering on our charitable mission, and they essentially meet quarterly and then do the final sign off on any awards that we're making. But those decisions will be based on the advice we get from our scientific advisory panel. And as Desh said, we're delighted we've got a few members of the panel on the call today to help us through this webinar, and they will be basically experts across a range of different scientific fields who will be able to actually assess and fully understand the applications that come into us. So their responsibility is essentially to go through and really properly assess, along with peer reviews that we will get for any of our funding awards, the applications that come into us. And that's essentially a structure to try and make sure that we are working within the kind of the best practice for making research awards that we can. And there's a little summary of some of the awards that we offer. Obviously, we're here to talk primarily about the PhD Studentship, which is a relatively new award that we set up a couple of years ago. But we do have a range of smaller awards, our research training bursaries. We used to offer project grants, which are our larger funds. We don't have any of those open at the moment, but we do often have project type awards in partnership where, for example, yes, we might be working with say Diabetes UK, and that award is a sort of a larger project grant type of award that we will part fund with our other partners. We felt that was just kind of a better use of the relatively small resources that we have at the moment. And then yes, there's a list down there at the bottom of some of the partnership awards that we have. Apologies, it's somewhat anagram heavy, acronym heavy at the moment rather, but hopefully you'll recognize a number of those, and those are, yes, organizations we work with part fund awards with, which really helps stretch the resources that we have.
Thank you, Guy. Thank you very much. So this is just an overview slide of kind of the typical pathway that applications are assessed through. So once you submit your application, an initial internal review takes place to make sure that the application is complete and that it fits our remit. Then the next step for your PhD proposal would be it's issued first to our internal panel. So members of our scientific advisory panel will be assigned to review your application to provide an initial shortlisting assessment process. While that takes place, the application will then be sent for external peer review, provided that it meets the threshold to be shortlisted to go for external review. Once that happens and all the peer review assessments come in with the final internal SAP responses, provided that the application meets a certain score threshold, it's then invited for further discussion at the main SAP meeting, the PRUK Scientific Advisory Panel meeting June, to make the final funding recommendation, which is then passed to our board of trustees for ratification. And then that's when we provide feedback. And we aim to provide as much feedback as we can, whether or not your application is successful. And then if your application is successful, then we go through to contracting, and then we monitor the progress of the proposal and of the research once it's been funded. So in terms of the review process, so as I mentioned, there's a bit of a check for the eligibility to make sure you're eligible for the scheme and that the application is complete. We will seek external peer reviewers for both the content and the methodology being proposed to make sure that we have as much of a expertise and input into your proposal to assist our scientific panel to make their funding recommendations. And it's usually 2 scientific members and both of our PPI members on the panel who are assigned to review each application. And then the proposal is discussed. And then if the proposal is recommended and shortlisted further, candidates will actually be invited for interview. So there's an interview process just to clarify any points of feedback and to meet the candidate before the final decision is made, which normally comes in around late July. And just to say, we also have a mentoring scheme. So this is a free scheme where you can sign up on our website to be either a mentee or a mentor if you want to offer your skills and expertise and time to support people in their research journeys, whether it's to present a conference, present an abstract at a conference, or maybe you want to know how to really integrate research as part of your career. Then we do offer a mentoring scheme, and we always welcome more mentors to the scheme. So if you are experienced or you know anyone who might be interested, please do refer them to our mentoring scheme to find out a bit more about that. Guy, should I pass back to you for this slide?
Yes, and I won't take long on this one, but yes, some contact details for us there. If you go to our website, you can find details of all the different funding schemes that we offer, and things like sign up for our newsletter, where we will send out in our newsletter in advance any of the funding schemes that we're launching. So it's a good kind of basis for hearing about the work that we do. Is just being signed up to the newsletter. But yeah, contact details available for us there. Please do get in touch if you have any questions or anything you want to check with us. So thank you very much.
Thank you, Guy. Well, that leads us to section 2, which is the key elements of a good application. Now, just going to provide a quick introduction on this before I invite some facilitators to expand on the detail behind this. So from my experience as research manager, having sat on many PRUK meetings, also having worked previously for NIHR, I typically kind of experience the same or similar points of feedback being raised time and again. And also that goes for what makes a good application. And from my experience, good application is where there's a clear background towards what the problem is or what the problem that's being investigated is. And as a result of that, what the key research question is. So it all makes sense and is all coherent. And the aims and objectives clearly align to that research question. And as you'd expect, the research plan and methodology aligns to what we're trying to address in the proposal. So the research methods are relevant, they're robust, and they're well justified as well. But the key of the application review process is not just about the scientific quality, it's also about the person. You know, the whole point of us having this scheme is to really invest in the future of pharmacy researchers and to help professionals to be able to level up in terms of their research experience and be able to go on to fund and to receive funding from other organizations in terms of research. So the person that we're funding is just as important as the quality of the application. So we want to know, why do you want to do a PhD? Why at this point in your career? How will a PhD help you in terms of your future research plans? What are your future research plans? So you'll notice in our application, we do want information about the projects and want to be assured that the project is feasible, but we also want to see, how is this going to help you in your career? What direction are you looking to head into? So we do factor in all of this when we review applications. So without further ado, I will pass over to our facilitators. I believe Reem, Deleth, and Teresa are going to be talking more about this. So I'll go into this slide. I believe, Reem, are you kicking this off?
Yeah, no problem. Thank you, Dash. So I'm Reem Kayali, and I'm Professor of Applied and Clinical Pharmacy, and welcome everybody to this webinar. So I think I would like to say that actually this is the most critical and difficult prerequisite for a good study, is to define your research question. And that's the same if it's for a funded PhD. So what would we look for? We would look for a clarity. So we really want a well-defined research question. Also, we will look for originality. So we really need to understand the genuine knowledge gap that raised that question. So why is it needed? What is it? Is it original? So that links to the next section of what makes a good application. Have we done the literature to define that research question? Feasibility, so can you achieve it within 3 to 4 PhD years, or is it very broad that it won't be achievable within? And do you have the resources, the skills, the supervisory team to achieve it? And then relevance. So, you know, Guy listed some areas which are relevant to this funding and nationally funded, you know, so it's really important that it has relevance to pharmacy practice, medicine use, and based on the areas of interest for the funding body. And lastly, is it testable? So does it give you measurable outcomes? Can you achieve outcomes as a result of that question with an appropriate methodology? So really showing why this question matters now and what is the gap it's answered. And I think one of the things I always notice that you need to link that research question, which links to aims and objectives throughout your application. So you're always trying to go back to those objectives that you set yourself in the beginning and making sure that everything is aligning with them. So I think we all are aware of the acronym SMART, and I think sometimes we we forget about it, but it is an acronym to keep in mind when you are defining that. So just quickly, because I know we have limited time, so just be careful. Do not make it too broad. It is one of the pitfalls that, you know, and it doesn't lead to clear outcomes. Make it focused, clearly measurable, so we can have a clear methodology and outcome as a result with it, and it answers a clear gap and a priority area within pharmacy practice. Other things when I was reviewing applications that I would like just to spend 1 minute just saying, I think that I've always noticed that there is sometimes a misunderstanding what is an aim and what is an objectives. So the aim is the broad area. It's not a topic. It's your general research question or overall goals. And you need to translate that to specific objectives. And the objectives actually, if you are doing a pharmacy practice project, it will be the questions you will put in a survey or your questions that you put in an interview. So you have to create the tool that answers those specific questions. So, you know, so if we're evaluating pharmacy first service as a general aim, we may want to know to determine how many consultations of pharmacy first within that region and what was the outcome. Is it self-care or is it antibiotic prescribing, for example? So you can see this become now a measurable outcome, whereas evaluating pharmacy first service, it was a very, very broad aim. And I wrote a few of applications that I reviewed that I didn't feel that objectives were defined. And sometimes you may end up with 5 objectives, whereas one broad aim in the top. So this is what I was going to cover within that. So I hope that was okay. I mean, we have later on other sessions where we can explore that further. This is from me.
Thank you. Thank you.
If I could just add really quickly, hi, I'm Delith, and if you don't mind just going back to the research question, because I just wanted to add one thing which might be helpful. So I'm Delith James, I'm Professor in Pharmacy and Behavioural Medicine at Swansea University Medical School. I'm a fairly new member of the PRUK review panel. So in terms of the research question, I mean, it sounds really basic, but sometimes people don't frame the research question as a question. It needs to have a question mark at the end. And maybe just something to think about, or to be clear on, is that, you know, if you're going to do some exploratory work that might utilize qualitative methodology, then your research question is likely to have an open question, such as what, where, when, you know. If it's a closed question, then that lends itself to quantitative methodology. And I think the RQ will be something that you're asked about wherever stage of your research you're at, having that research question at the tip of your tongue that rolls off, because you will be asked it again and again and again. It needs to be a question, and quite often it can take quite a long time to frame your research as a research question and then refining it. So don't expect that you'll be able to write it straight away. So having conversations and coming back to it and refining it can take a bit of time, but it's worth spending that time, because if you get the research question right, the rest can fall into place. So I just thought I'd add those from my experience. Thank you. And I think this, oh, sorry.
Yeah. Yes, my name is Teresa. I was going to just talk a little bit about the PPI side of things. I'm one of the PPI members.
I think that comes a little bit later, Teresa.
I might have jumped in too soon. Oh, my apologies.
That's okay. I think there are 6 sections, and I think PPI is towards the end. I see Dash nodding. So, yeah. And I think from recall, I'm leading or jumping in first on this section, which is to do with the strong context of the research and the literature review. So, I mean, as it says on the slide, it's important to have, show a strong understanding of the field or the existing literature, and to identify, make it clear what's missing in terms of the science and how your research projects aim to fill that gap. Just to bring that to life a little bit, I have a number of people coming to me saying, oh, I want to do a PhD, Delith. I think that's brilliant. How will you fund it? And that's the next sort of question. And then, of course, my next question will be, well, what does the literature say, and where will you start? And quite often people say, oh, I don't know. I haven't been to the literature to see what's out there. I'm sure that's not the case for the people on this call today. However, I think if you can look to see if the systematic review of the literature has been done already in the area that you're going to be researching, that is a huge kind of bonus or benefit, because you're starting your research at a stage where you're adding, I call it adding the brick to the existing wall. You know exactly where the wall ends and what the brick that you're adding, if that analogy works for you. Very often you don't have the the literature review or systematic literature review and meta-analysis available to you, and so quite often the first stage, first year of a PhD would be to undertake a structured or systematic review of the literature or scoping review of the literature in order to fill that gap. And so I think it's always worth thinking about those two things at this stage, because it's useful not only to explain where the research has been done so far in your field, to outline the gap, but also what parts of the literature review or searching will need to be incorporated into your PhD or whatever stage of the project, whether it's a master's project or other stages. So that's really all I had to say from my experience. Teresa and Keem, Reem, I don't know if you've got anything to add to that.
Thanks, Dilith. I mean, I would just say that when you're completing that part, just think you really need to summarize what is known about the topic and what is contested and what is missing, because that will define then, I'm linking it back, that will define then your research question. So it's really, sometimes it's not just describing the studies, critically evaluating, because you really need to convince us that there is a gap in the literature that you're going to complement in your research. And that's what brings us to what Dilith was saying, that as usually the first stage of your PhD is doing more of that literature because there was a gap. If it was already completed and done and there is meta-analysis, the area was not worth researching, isn't it? Because maybe it's already completed. So this is all from me on that. Unless anybody wants to add anything, then we can probably tie it in with the methodology dash if you want to move to the next slide. Okay, so having done your literature, identified the gaps, you set your defined well-researched questions, and now you need to come to the methodology. And if you listen to what Desh was saying carefully, he said one of the things that they will ask the external reviews to comment on is your solid methodology. So this is a big critical part of a successful research proposal. You want to convince us that you know how, or you stipulate how the study will work in practice, and the chosen methods are appropriate for research questions. So if I was going to give you a bit of things to think about, always try to describe your, with a few sentences, your clear methodological approach. Is it going to be qualitative? Is it quantitative? Is it mixed method? And we are not all research experts. And when you start your PhD, you may not be research experts. I mean, I moved from lab research to social research, so I had to learn it at a later point. So it will be worthwhile just doing a big Google search and just putting research paradigms and understanding where you're coming, the theory that you're coming with that research. It may be a bit advanced, but it'll just give you a solid foundation when you are listing your methodology, because it shows that you also understand literature towards that methodology. What made you choose that methodology? Because we want to see justification. We want to see why this method, not other method. And that's why I'm saying sometimes when you're doing your methodology, it's very important to think, is it going? So if it's qualitative and interviews, is there a already validated framework that will support your interview schedule design, for example? Is it? So let's, and I'm, with everybody pharmacists. So the simplest framework will be, for example, COM-B for behavior change. So capability, opportunities, motivation. So is it linked to some framework? Because that gives it certain robustness. Or is there surveys that are validated? So if we're looking at technologies, are there surveys that are validated? One of the things I always quite see discrepancy in is the sample population. Is there a method for calculating sample population? Who's the targeted sample? Have we defined it? What is our sampling strategy? Is it random? Is it purposive? Is it convenient? Why are you choosing that population? How are you going to recruit them? And please remember your inclusion exclusion criteria. It's very important that we look and see who is your sample, and that number doesn't change across the application. Validity and reliability, that's why I said to you, if you look a little bit in the literature, you may convince us that actually your survey is a validated tool, or if it's not and you're designing your tools, how are we going to validate them? What is the pilot that you're going to do? Then you should shift to data analysis, a big critical part. So you've decided your sample population, your tool, you told us about the tools that you're going to use, then you need to go to data analysis. And depending on your method, Qualitative, is it going to be thematic? Mention a reference for thematic, so don't just say thematic analysis, just make it, is it 6-step framework? If it is quantitative, the stats, have a statement of a stats, or at least say it will be discussed with a statistician, so we see that there is confidence in that your ability to do that statistical analysis. The other part that you should not miss is ethics. Ethical consideration, any study that requires human participation, you really need to consider ethics. So you can't just brush that through. You really need to tell us how we're going to seek ethics, how we're going to protect those participants, consent, and so on. And any application then needs a timeline, because we need to see that your methodology is achievable within a timeline. Some people will attach a Gantt chart, but you really need to give us how you're going to do it. Last but not least, be anticipatory of limitations. You may not be able to recruit that sample population. You may not be able to, ethics, for example, timeline. How are you going to make sure that it's not going to delay recruitment and so on? It's facilities, equipment, training, just think and anticipate, because it is important that you anticipate and you have the mitigation strategy. So really, really, we want to see how you will be collecting the data, how you will be analyzing it, and will that method answer the research question? So always go back to your research question. Have I picked the methodology that answers my research questions? That's all what I was going to say about the methodology, unless anybody wanted to add anything else.
Yeah, I'll just add that this is the big section, really, that I think it would be really difficult to put a robust methodology and design together that Reem was describing without maybe some guidance from either a methodologist or an academic. And I think this is where those partnerships with your higher education institutions or people in your practice-based who have done a PhD, I think it's important to have those conversations, because the same research question could be answered in multiple different ways. So it's about you having those conversations to come up with a justification for why it's the right one for your research question that's going to get nearest at the truth, really, whether that's mixed methods or in one paradigm. And then I think in terms of the timelines, as Reem was saying, some people present this section as work packages, and the work packages might, you might have 3 or 4 work packages that align themselves with the 3 years of a PhD, and that can be quite a useful way of just thinking about how realistic it is to do these things as well within this time frame of the PhD, and to package them in that way is really helpful for a reviewer as well to see how you're going to approach it. So that's all I was going to add to that. Thank you.
Would anyone like to contribute to the significance? I mean, a lot of the points raised already kind of linked to this. So, the area that we typically fund is in pharmacy practice, which is very broad, purposefully. The only things that we do not fund specifically is lab-based research, but other than that, we would accept any application within that. But as the facilitators have already said, as Reem and Delef have expanded upon, if you can make sure that your proposal is clearly relevant, that there is a need for your research, that your objectives align to your overall aim, and then you have a robust methodology to back it up, in that you've been speaking to your supervisors or experts in the field to make sure that it's a relevant methodology and an appropriate research plan, then that will help you to achieve significance and impact in the longer term. So those are things to really consider. And I think piecing together each section of your application as best as you can help you to have as great an impact overall. I don't know if Delef or...
Yeah, I would agree with that. And I think just to add to that, I think because we're healthcare professionals working in practice, this in some ways is the easy bit for us, because we want to make sure that the research is going to have impact or can be translated into clinical practice. And if the problems that you're addressing as part of the PhD or your research come from a problem in clinical practice, then it's much easier to go full circle than to have impact. So what this is, funders won't touch research, sort of very theoretical research that's never going to have any clinical implications in the real world. So it's about what difference is your research going to make, and quite often that's obviously for us in patient care or services, and making that really clear is going to be important, so it's not assumed, because sometimes we assume that other people will know the difference it's going to make, it could make, or the change that could result. So making that and the pathway to impact, how you're going to help to disseminate the information in a way that will reach the right people or the policymakers to make that change, is always useful to have an eye on as well. Yeah, that's all I would add to that.
Thank you. And yeah,
sorry, Dash. I'm just going to put concise points. So I think of impact on pharmacy practice. Think that it aligns with PRUK strategic priority. If you're looking at it, you know, who will benefit from it? So who are your potential beneficiaries? I think sometimes outputs can be linked in here, like dissemination. So outputs, what would you get out of it? Is it publication? Is it intervention? New evidence? What is it? And last but not least, we may want to think what would be the long-term potential. So it's maybe not the short-term impact, but long-term, how would that change? And I'm just saying that because it may not be just for PRUK. If you're applying funding elsewhere as well, you benefit from considering those points. Thanks, Desh.
Thank you, Reem. Appreciate that. And I think that, as I mentioned before, you know, that we are funding the applicant, we are funding the person to lead the project. So I know so far the focus has been mainly on the project, because that is important. That's an important part of the review process. But we also want to fund the right applicant. So we want to know more about you, what your skills are, what you're currently aspire to become more proficient in terms of your research skills, in terms of your career, what your background is, what you'd like to be doing, what your motivation is. And I think a key part of that is to have support networks in place to help facilitate that journey for you. So supervision is a key part of the PhD proposal. It's essential for us to be able to be assured that you have ongoing support throughout your PhD journey, and to make sure that you have your training needs met as well. But it's also thinking for yourself in terms of, all right, I want to undertake this PhD. What courses are available? What training do I need to really facilitate my own goals? And so that's something we're really keen to learn upon, and that's why we have an interview process as part of that. I think before we move on to PPI, was there anything to add to this point?
I'd say just
not from me. Sorry, not from me. Thank you.
That's good. I'd say all funders are now interested in that. So it's you know, whether it's NIHR, Healthcare Research Wales in Wales, it's that the project, the person, and the support. That those are quite often the things that you're assessed on. And so if you can show a commitment to research, so you know, from your, whether it's your undergraduate MPharm projects or your audits or quality improvement projects and other things that you'll have presented at conference or published, you're demonstrating that you're showing a real commitment to, you know, publishing and outputs. So they're looking at a bit of a trajectory as well, really, so that they're showing that you're going to go above and beyond, really, not just do the PhD for the sake of doing a PhD. You're showing that everything you've done in the past has been towards you know, making a difference and having an impact in practice. So the more you can demonstrate that, the better. And of course that it fits with aligns with your practice area. So if you're, you know, if you're an antimicrobial pharmacist, then clearly having a PhD that sits in that area is going to show a really good fit. But if you've been working in manufacturing and suddenly you want to do something completely different, then you'd go, oh, that doesn't seem right. But I'm sure that's not the case with people on this call. So yeah, I'll stop there.
Thank you, Della. And last but certainly not least is PPI, which is a crucial element throughout the whole application. Not sure if Della or Teresa, if you wanted to jump in first.
I don't mind going first, or I can wait, Della,
Sure.
if you prefer. Yeah.
No, go for it, and I can just add anything that at the end. Go for it, Teresa.
Thank you. Yes. So yeah, as I mentioned before, my name's Teresa. I'm one of the PPI members. So my focus tends to be looking at the burden on patients and how patients are involved, and in terms of evidence that the PPI has shaped the research question, the design, the dissemination, Try to involve patients directly from the outset. If you have an idea that you think needs to be researched, how will this benefit the public in the short term and the longer term? Can you meet with patients to explore different research questions, or to shape the question and make sure that general public will understand the potential benefits for them? Important, of course, is during the project, how are patients to be involved? How often? Sometimes there's focus groups, sometimes there's one-to-one calls and interviews. Are there any physical demands on the patients? Sometimes the research will say we're doing blood tests and things like that. Are patients required to visit premises they're not used to, maybe a different hospital or a different GP or something that they would be their usual? Are there any travel demands? Things like access needs. So if you are holding any sort of involvement groups or anything like that, how are patients going to get there and back to attend these focus groups? Will you be able to recover to cover their costs, so out of pocket expenses? If someone needs a cab, will that be factored in? Oftentimes I've noticed in applications there's not much in the way of budget for this, and maybe researchers don't think that could be a burden on patients if they've got to make additional visits or additional appointments. Think about if patients will need to have their carers with them or a relative with them. Will all of that be factored in? The importance of patients making informed choices, and will it be clear how much time and how they exactly have to be involved? Will they have a choice about how much or how little will they be involved? Make sure that they know that their involvement is optional, and if they have to leave, they can. The importance of remuneration for at least out-of-pocket expenses, or for their time for vouchers. Some applications do and some applications don't. So I'm surprised when I don't see that at all mentioned. And then when it comes to things like dissemination, have patients had a chance to say, how they would like to find out? I think people like to know how their involvement benefits this research. So will they be notified as well as through publications and things like that? So how will you share the findings with the public, and how will you do that in a suitable way for the individual person involved? I think those are my main thoughts. I don't know if anyone else wants to add anything I might have missed.
Thank you, Teresa. That's such useful insights from the PPI perspective. And again, I would say you can have an excellent project, an excellent person, but if you don't have the PPI in place, then the project won't get funded. And that, again, is across the board, not just for this funder. I think you mentioned the budget. So some of the panels I sit on for other doctoral fellowships, I think it's gone are the days where it would be 1-2% of the budget on PPI. Now it's sort of between 5 and 10% is expected. So that which shows real commitment, not that tokenistic. I've seen a lot of proposals that say things like, yes, we've involved PPI in the development of this research design. And then, but what you need to say is, how have you involved PPI in the research design, and critically, what's changed as a result of it involving PPI? That's what we're looking for, and that shows real sort of, it demonstrates to us that you're taking it seriously, that you've changed things based on that PPI input at those early stages. I've sat on an NHS ethics panel for years, and the people that, the applications that tick the box say, yes, we've included PPI all along the way. When you got to look at their participant information sheets and their consent forms, it was clear that they hadn't. And the ones that are doing it, and really going through it seriously, you can see the impact those have on the information sheets, because clearly they've been reviewed, or the interview schedules and things have been reviewed by participants. So one really nice way of making sure that you're showing you're serious about this is to set up an advisory board or a steering group for your project, which you probably would be doing anyway, and making sure that there's 1 or 2 people PPI members on that. And you may have set that up already, or you may have had the PPI input already, but that ensures that throughout your 3 years or whatever, that you're showing that periodically you're going to be getting that PPI input. And that reassures us then as reviewers that you've got a system set up to make sure, because you can forget about these things quite often, so yeah, those are the 3 things from me: the budget, the advisory board, and making sure you say what's changed as a result, so it's not coming over as a tokenistic thing. Thank you.
Thank you all very much.
Oh, can I just add in something else? Apologies, I
Of
just
course.
thought now about importance of thinking about any potential emotional toll on the patients, regardless of the condition that's being researched. The patients, it might be a new diagnosis for them, it might be something they've been grappling with for years, and they might be they'll have their usual doctors and care teams that they're working with. So having new people coming in and talking about their symptoms, their conditions with new people, there can be an emotional toll. So try to think of that as well. It might not be possible to completely avoid it, but you might be able to ameliorate it with people, and factor that in when you're sort of research, planning and designing the research and how you're going to carry that out, and ask the patients themselves. That's always, don't second guess, just ask the patients themselves what support they need, and they will tell you. Thank you.
I know you're rushing with time, but I just wanted to say one word. So just remember that you also, following Teresa, supporting the PPI members, and just think of the inclusive ethical involvement, so vulnerable groups, communication, so take that into consideration. And that's all what I'm adding here. Thank you, Desh.
Thank you. No, I'm sure I can make up time later in the session. I think this is all really important information, and to Teresa's point, we can become so focused on the projects and the plan and making sure the methodology is robust, but at the end of the day, this is research impacting patients, impacting the public and the healthcare services. So we can sometimes maybe lose sight of that when we're so immersed in filling out applications and meeting deadlines. So yeah, Teresa's point and all the facilitators' points so far are really valid. And if you consider those points, factor them in, you'll be on a good path to developing a strong application. And this leads us to section 3, which is the common pitfalls. Now, a lot of what will be covered in this section will be kind of similar to what we've already spoken about, but I think it's important that we rehash and really focus in on what are the common pitfalls or mistakes or oversights that applicants have made in the past, which is what we, as a hiring panel, have typically fed back time and again. This is what we want to focus on in this section. So it could be things we've already spoken about, maybe an unclear research question, an over-ambitious proposal, a timeline that's not really feasible. So these are things that, again, in the midst of preparing your proposal, you think, okay, this looks good, but you have to see the bigger picture to see, is it actually feasible and deliverable? Have I thought about what methods are put in place? Have I got support in order to be able to carry out and deliver what I'm saying I'm going to in this proposal? So these are things that we need to think about. And I'm going to hand over to our other facilitators, which is Adam and Heather and also Teresa, for this section. So I'm not sure who wants to kick off.
I'm happy to make a start, Desh. So hi everybody, it's great to see so many people on the call wanting to find out more about research funding from PRUK. My name's Adam Todd, and I chair the Scientific Advisory Panel for PRUK. So I suppose my colleagues already have done a fantastic job in terms of telling you what we are looking for a good quality research application. In many cases, the common pitfalls are almost the reverse of that, really. And as Desh said, we've got some key areas that we think are fairly common that we see throughout the panel when we are assessing research applications. So I think the first one really is a lack of focus or clarity. And I suppose as pharmacy professionals, we are very much focused on a specific area of practice. That might be like a topic area, something, or we might have some pharmacists on the call that specialize in a certain area of therapeutics, say. So I think what we want is a description of that area, which is important, but we're also looking for something beyond that. So we're looking for research questions that are understandable, stated, and that are really well defined. And sometimes we see applications that don't have research questions, for example, or the research questions are just too broad or not clear. So I think the first thing that we really want to think about is, what is the research question? What is it they want to do? So beyond the topic area, so it could be that you work in antimicrobial stewardship. Well, clearly there's a lot of literature about that, but specifically in that space, what is the question that you want to address with your research? So that's as I said, the first thing we're looking for. And research questions should be really clear and understandable. And if you are explaining your research question and you can't explain it in a couple of sentences, it's not quite there. Or if people don't understand it, again, it's not quite there. And again, we've got a section on patient and public involvement and engagement. And again, I think that's a perfect place to almost try out your research questions. So do people understand it? Do people know what you're trying to do and trying to achieve with the work? And I suppose the next thing is also about objectives. So again, we have research questions. So what is the question you're trying to answer? What is the aim of the work? So what is the broad overarching aim of the work? And what are the objectives you will address to answer your aim in your research question? And again, sometimes we see things where aims are stated, research questions are stated, and objectives are stated, and those things don't match up or they don't align. So for example, an objective might contain a new idea or a new area, and we think, well, the research question has nothing to do with that specific objective. So if that's the case, it's then very difficult for the panel to assess how feasible your research question is. Heather, Teresa, do you want to add anything on that?
Yeah, I was just going to chip in there quickly, Adam. Thank you. Hello, everybody. My name is Heather Barry. I'm a senior lecturer in pharmacy practice at Queen's University in Belfast and another member of the Scientific Advisory Panel. I suppose just to come in on the last point, we need to see that linkage, obviously, between the research question and the objectives and those marrying up, but that also should continue throughout the application into the other sections. So it should be very clear then when we come to your methods as to how those methods link back to your objectives and the methods that you've outlined are going to answer your research questions as well as meet those objectives, and moving on through then to the outcomes or the analysis that you're going to conduct as well. That should all link through. So there should be very clear linkages all throughout the application form. And I suppose and we'll probably come back to this when we talk about the methodology and sometimes some of the frustrations when sections are maybe a little bit vague on detail. So really think about the structure to your responses for each and every section or question. And in doing so, that should also help you to make sure that you're mapping and linking through across the application as a whole.
Oh, can I just quickly add something briefly on the clarity, very briefly, from the sort of the PPI point of view, when I'm reading applications, and this relates to the section, the plain English summary. So when I'm reading those, sometimes they can be quite jargony, or I'm trying to sort of think if a patient was reading this, a general member of the public was reading this, is it clear what health problem we're trying to improve, and try to avoid jargon and things like that. It's plain, it's called the plain English summary, but it doesn't always come across that way. So yeah, so you think of sort of the patients and the general public, if they were reading that, will it make sense? Will they know how this research is going to benefit them? When will it benefit them? Is it going to be a short-term benefit, long-term, that sort of thing? And please try to avoid jargon in that section if you can. Thank you.
Thank you.
Okay. So maybe if we move on to the next one, which is really about the context of the research, and I suppose this is really related to your literature review, and there's a lot of research done on a lot of different topics relevant to pharmacy, and I think it's about how does your work fit within the current literature? And clearly you can't do that until you have done a literature review and you understand the literature. So that's important when you present the proposal. But I think what we often see is that, there might have been, I don't know, 10 qualitative studies done on a particular area of pharmacy, and your project proposal might want to do another qualitative study. And that's absolutely fine. But if you're doing that, you need to explain actually maybe what are the gaps, what are the weaknesses, and even what are the strengths with the previous work done in this space, and how will your work be different to those, and how will your work kind of develop, or I suppose develop or enhance knowledge and understanding in that particular space. So I suppose it's no good saying, there's been a really excellent Cochrane review published on this specific topic, and it was published 3 months ago, and I plan on doing a similar review for my work. So again, as the panel, you'd be saying, well, why is that when there's been something done already, or this has been researched in a lot of detail already? Why do we need yet more research on it? So I think it's about showing how your research will build and expand on current knowledge and understanding. And again, I think one of the key things with the application, and I think Delith mentioned it already, is that you shouldn't be doing the application really by yourself. It shouldn't be done as an individual. It should be done as a team, I think, around you. And I think it's also saying, well, this is the research question I think I want to answer. These are the studies that have been done in this space. Maybe thinking about what are some of the problems with these studies, what are some of the challenges with them, and how will this work go on. So I think, again, talk to the people who might be supporting. If you're interested in the PhD proposal, for example, get an academic team around you that has done research in this space, whether or not that be topic research or methodological research, but think about how your research will just move on from what's been done already, and kind of build on current understanding. And the application really needs to be clear about that, even to the point where you might have bullet points. You might say, well, current research has shown this. These are some of the limitations. These are some of the problems with the research. This might be something that you found in your practice. And then again, further bullets around, this is how my proposal will address these limitations. Because if you do that as a panel assessing the application, it makes it really easy actually to say, well, I've thought about this is really clear, this is good. It's just when it's not clear from the application, and then again, that makes it difficult to decide to fund something.
Yeah, don't expect us to, or don't expect the reviewers to kind of join the dots. So, as Adam said, do sort of outline it very clearly for the reviewers, and in essence, I think you're really trying to build as strong a case as possible for why this research or your project is needed. So, but I think sometimes when you're so consumed by something, you can see the linkages very clearly, and it seems obvious to you why your research is needed, but you have to think about the reviewer on the other side of that application, reading it. So do make all of that abundantly clear.
Perfect. Teresa, have you got anything to add for this? I think you might be on mute.
Yeah, no, and just again, think about the how you're going to involve patients and benefit, how it's going to benefit patients down the line. Sometimes, again, it comes across as very technical, so try and sort of keep an eye on the lay reader as well.
Yeah, perfect. Okay, thank you. And I suppose the next one we're talking about in terms of common pitfalls are around vague methodology. And again, as my colleagues have already said, that this is an important part of the proposal. What we expect to see is, a clear set of research questions, a clear set of aims and objectives. And then we want really a plan of methodology to tell us how you plan on addressing or answering those research questions and aims and objectives. So again, that enables the panel to judge, actually, are you using the appropriate methodology to answer those questions. So again, things like we might have discussed on the panel previously was, this is what they want to achieve, but actually the method they've chosen, they won't be able to answer those questions. So I think it's about being, again, really clear in terms of what it is you're going to be doing, and why having that justification is really important. And I think, you know, we tend to think about qualitative research, quantitative research, and sometimes evidence synthesis, which is absolutely fundable. But I think it's just describing specifically what it is you're going to be doing and why. And I think another part of this is that, again, really giving the panel confidence that you will be able to achieve what you want to achieve in the allocated time. And I suppose that'll come up shortly in terms of being over ambitious, but it's just so we can judge, actually, is that realistic, is that feasible? So if you're planning on recruiting patient participants, how will you recruit them? What are the potential challenges of recruiting them? What things could you do to avoid those potential challenges? Or if you want to access data, what data is it? Have you accessed it? Has it been accessed for research previously? Just those sorts of things. So rather than just state you're going to do this, it's about saying you're going to do this and why, and this is the justification, these are the potential pitfalls, and this is how I'm going to mitigate against that. I think that's really important.
Yeah. I think this is one of the most common pitfalls, and probably one of the more frustrating things when you're reading an application and the methods are just not detailed enough, or just don't contain, you know, the detail that you need to see. And again, a lot of it comes back to structure and sequence. You know, think about the order in which you're going to do things, and that will probably lend itself to outlining this section in that manner. And don't be afraid to use, you know, subheadings. Delith talked about, you know, breaking things down into work packages, for example. So maybe that's, you know, an approach, but even within those work packages, you know, break down maybe into, you know, use subheadings so that again, it's very clear for the reviewer to see exactly what's being done, the order in which it's being done, and why it's being done, if that detail is there. And I agree about thinking ahead about challenges. Recruitment is a really good example, because no matter the study, it's generally always a challenge in some shape or form. So it's thinking about that ahead of time. As Adam says, what mitigations are you going to put in place? You know, very often having a number of different approaches to recruitment is usually a good idea to think about ahead of time, so that you can put all of those in place. And it's just really, I suppose, showing that you've thought about all of those challenges, and particularly the time isn't finite. So you know you need to achieve your goals within your PhD project, but you know, don't waste time just letting time elapse if things aren't going to plan. How are you going to get around them, and use your time wisely?
Thanks, Heather. Teresa, do you have anything to add about the methods, or you good? Yeah. Okay. So the next thing really is about you as an individual, and you know, again, what we often say at Pharmacy Research UK is we're absolutely interested in the projects, but we're probably more interested in developing the people. And so we're interested in you as an individual. Why do you want to do the research, and how does that fit into your long-term plan, your long-term work plan? And I guess for me, there's no right or wrong answer there. It's about, have you thought about it, and is that stated in the proposal? Now that might be about developing, you know, doing research on a potential service, to think about developing services to improve care of patients. That might be thinking, oh, if I do this, I could then go off and do a bigger study in this, or I could think about a bigger fellowship, or whatever that is. What we're interested in is you and what your plans, and how this research fits into your plans. I think that's really important. And the other thing around that is training as well. So, you know, what are your training needs, and how will they be met? So that might be thinking about working with again, an academic team, with an academic institution, thinking about specific training courses. When you'll be doing it, might be collaborating with certain people to develop your skills. Again, there's no right or wrong answer really. It's more about, have you thought about your long-term plan in terms of you and also your training needs, and again how they will be met. I think that's really important.
I suppose it's trying to demonstrate why investing in you is important. It's obviously a considerable sum of money, so it's again making that case as to why, you know, we should give you the money to do the PhD and how that's going to develop you. And maybe think about your goals, you know, sort of shorter term, medium term and longer term. That might be a good way to help structure it as well.
Yeah, thanks, Heather. Oh, okay, so the next one. So the next one, just ignore the puppy. The next one is probably the most common that we see in terms of both PRUK and also probably other funding panels that I sit on. And this is about being too ambitious. So I think, you know, people often think, oh, if I'm, you know, particularly if I'm applying for a PhD, I've got to have like lots and lots and lots and lots of work. And that is true to an extent. But I think people try to think, oh, if I do lots and lots of work, I'll probably, or if I plan to do lots and lots of work, I've got more chances of being funded. And again, my experience is it's the other way around. I've never heard a funding panel ever say, we're not going to fund this because there's not enough work in the plan. That almost never happens. It's always that actually they've got enough work in here for, say, 2 PhDs. And actually to do this, it's probably going to take them 15 years or whatever. So don't try to do too much work in the allocated time. That's really important. We are looking for, when we decide to fund things, we need to be confident in the individual and the academic team around them that they will be able to deliver that research in that allocated time. And again, doing research always takes you a lot longer than you think it will take, whether that be getting ethical approval, recruiting people, analyzing things. It always takes a lot longer than you think. So don't give yourself too much to do, because again, if we're assessing it, we'll be saying, do you know what, this is just far too much. And actually we've had conversations where we've said, if they dropped, I don't know, the quantitative study or work package 3 or whatever that is, it's probably a lot more fundable, but as it is, it's just not fundable. So please don't think you have to absolutely pack your proposals with loads and loads of work. Obviously it has to contain, you know, a sufficient body of work to get a PhD, for example, but don't be too ambitious with it, would be my advice. That's really important.
Yeah. Thank you.
Yeah, anything else to add on that?
No, I think you've covered that.
Perfect. So I suppose the other thing is, and again, I'm going to bring Teresa in a second, is that, you know, we, like all research funders, is we want to think about the patient and public involvement and engagement. And, you know, is the work that you're doing, how is it being shaped through patients and the general public? And actually, I think, again, as pharmacy professionals, we should do really good with this, actually, because, you know, we should be speaking to our patients and the public about what they think about the plans that we have. But maybe, you know, your research question has come from, it might come from a patient, it might come from a negative experience that's happened in practice. It might just come from maybe a service that isn't working that well. So I think we could be really good with that. But I think for me, it's about when you are explaining the PPIE, is how have patients shaped what your plan is already? So actually you've got to a point where you're submitting an application. How have patients been involved in that? And then what is the plans kind of going forward? I think that's the key thing. So having things that actually, you know, this work has been, I don't know, co-created with a patient and public involvement group. And that's very clear how they've been involved. If it's a case of, you know, I've developed this PhD proposal fully, by myself as an individual, and if it gets funded, I'm going to take it to a PPI group and ask them what they think of it. I suppose if that's the case, that's not really great PPIE, and those things that tend to be thought of as quite tokenistic. And again, you know, I've been part of PPI panels where people have actually done that, and it tends not to go down very well with the group. So that's really important. Teresa, can I bring you in here on this?
Yes, and I agree with everything that Adam just said. Just sort of make sure when you're writing your application that you explain clearly how the patients are involved, the importance of informed consent, and you can consider the burden, if any, on the public, whether it's a physical burden, an emotional toll, are there any financial costs? I think I mentioned before, I'm quite surprised how often there's no mention of PPI in the budget, and there's no sort of mention about making sure that patients are involved in accessible ways. So, you know, you might have patients that have got more than one health condition or something like that, or you might decide we're going to do a focus group. Is it going to be in person? Is it going to be a hybrid? If you're going to interview patients, will it be by phone? How, you know, I'll always ask the public and the patients that are involved what support they need, and budget for that so you can put that in place, and make sure you ask patients how they would like to be informed of their the difference their involvement is making, because I think I mentioned before, sometimes it's just we'll publish it or we'll notify charities about our results, but will the patients who've been involved just be sort of left unsure about what's happening? Have I helped? Have I not helped? What's going on? Can consider things like if patients have carers, if you're going to cover out-of-pocket expenses, which I would say is a minimum. Make sure that, you know, some people might need taxis. Ask people how are they going to get there. You know, the short answer, I suppose, is ask patients what support they need, and be prepared to sort of budget for that and factor that in. It does come across, I think, as Adam was saying, it's a bit sort of an afterthought, and if the patients aren't sort of key all along the project, and if it doesn't come across to the PPI assessors how the public have been a key part of this, and how, you know, how they've been consulted and able to shape things, not just sort of passively getting involved in being told how they wanted to be involved, but they're able to shape the question and ask questions. They can have an involvement, and it's an element of co-design and things like that. This is all very important, and it from the lay reader, it comes across better if you can demonstrate that you've been doing that, rather than, you know, decided on something and we're going to tell the public what we want from them. That doesn't read well, it doesn't come across well, and you know, it's quite common for that not to have. It comes across as an afterthought, so just be wary of that. Thank you.
I was just going to add in, I mean, NIHR have some really useful guidance on sort of rates of payment for PPIE contributors, and whilst it's not mandatory, I mean, it can be used as a guide or a benchmark, really, depending on the activity that you're planning and the time that might be incurred in undertaking that activity, whether it's preparing for meetings or doing something more substantial. So that can be quite helpful to give you a bit of a benchmark when you're trying to cost that out, because as all of the contributors today have sort of talked about, that's a really important one to make sure that you give due consideration to that.
I think if I just add one more thing, that again, I think, you know, you don't have to create a new PPI group for a project. Absolutely not. I think, you know, we need to be mindful of maybe PPI activities are a little bit burdensome for people. And I think if you are working with an academic team, if it's about the PhD and supervision, it could be that they already have established groups for certain topics or for certain things. So it's absolutely fine to say you will use an established group, or you have already used an established PPI group to get advice on a specific thing. That's absolutely fine. And in many cases, sometimes thinking about from our perspective, again, we want confidence that a thing will happen. And if you're using an established PPI group, we know that that's already there and that's a thing. So that can sometimes also be beneficial.
Can I just add in one last point, just on the last bullet point there about lack of inclusion or diversity? That is something that doesn't really get mentioned very commonly in applications. And I would just say, if there are sort of unavoidable limits, then please explain that, because it might be that you're investigating a certain condition that affects certain groups of people more than others. So it might be an age-related condition, might be more common in older people. It might be that gender might be a factor. It might be that certain ethnicities are a factor. So there might be unavoidable limits on diversity in terms of your patient group. If that's the case, then just make sure that that's clear for a lay reader to understand. Thank you.
Thank you all so much for that. That's really useful. And I'm conscious of the time, but I didn't want to take any time away from facilitators, because a lot of the information shared is exactly the kind of feedback that we often give. And we know that if you are equipped with the knowledge of how to address it, then you can provide a really strong proposal that has a good chance of funding. It's all those elements you have to think about. And I know it's a lot of information to consider. However, if you look at the application forms kind of broken down into different sections, and it's kind of start with the literature review, the research question, you work your way to the dissemination strategy and what your own plans are. So it kind of flows. And my recommendation would be just to, when you write up your proposal, give it to a family member, for example, or maybe a representative of your to read through. Does it make sense? Is there proofreading? We've seen proposals where there's been spelling mistakes, and while in the grand scheme of things you could think that's minor, it's an indication that, has the applicant really proofread it? Have they sent it to anyone? So it doesn't look great. So really, these small things actually do add up a lot. Right. I do not want to take any time away from the interactive exercise. I may have to shorten it a little bit. Then after that, we can wrap up and do the Q&A. But if we want to take a short comfort break and maybe be back by 12:20, I know that gives us 3 minutes, but just enough to stretch your legs, and then we'll jump right into the exercise if everyone's happy, so we don't take up too much time. Okay. Thank you so much. Okay, everyone. So what we'll do is we'll get started with the interactive exercise. So you should have all received in your attendee packs some excerpts of a mock application. And the idea is to work through each section, and there are some questions to accompany that section in terms of things to think about. What's good about the writing, what's not, what did the applicant, not think about, or what should they consider? Now, the aim is not to complete the whole exercise, it's just to get you to kind of think and develop that kind of critiquing mentality in terms of what things do I need to think about, what things do I need to add, or what's good about the excerpts. So hopefully you all can see that, and you'll be assigned to a room with the support of a facilitator to work through that exercise. So I would like, I'll give you all until 12:50 for the task. Then that gives us 10 minutes at the end just to wrap up and to get any questions in, if everyone's happy. So I'll shortly be creating some breakout rooms that you're going to, and then I'll invite you back in for the main meeting for 12:50. Welcome back to the main meeting. Apologies, we'd run behind time, so I had to take out a little bit of time for the interactive exercise, but I hope that you found it useful and interesting. And we've got 10 minutes remaining until the webinar closes, and I want to make sure there's enough time for questions. So maybe I could invite maybe one or two of you to speak about what you've taken away from this webinar or how you found the exercise. If there's anyone who wants to give any feedback or has any questions, I'll be happy to open it up to the floor. Go on, if I'm hopefully saying your name right.
Yes, thank you. I just wanted to say I found this webinar incredibly helpful because I think, lots of us who are quite senior pharmacists have probably attended lots of various talks on research over the years, but this one has really gone into the nitty-gritty of how to do it well and how to do it right, and to talk through the application itself. So personally, I found it really informative, and just, you know, going through that level of detail has been really helpful to me. So thank you.
Thank you for that feedback. No, we're really pleased to hear. And I know that, you know, it's already quite a daunting exercise to put together a proposal for funding, let alone a PhD proposal, and to speak with your supervisors and, you know, to try and get support. I think it's useful to be able to have access to information from the panel, from an assessing panel. So yeah, really, really happy to hear that. Thank you so much. Did anyone have any feedback or any questions at all? Oh, Adam.
Desh, I suppose not so much about the exercise itself, just more about encouraging people on the call, you know, to reach out to academics and you know, send them an email, or don't. I think what's clear is you need an academic team around you to develop the application. That's important for the development of the application itself, but also that supervisory expertise and team as well. That's super important. So don't worry about, oh, I don't know anybody, I'm not sure, or this person does a thing but I don't know who they are and I don't want to approach them. Send them an email. You know, academics love talking about the research, absolutely 100%. So even if you're not that sure, just contact them and say, can I have a chat? Can I have a conversation? Just, I'm interested in doing this. Can I just pick your brains? Not a problem. As I say, I tend to do that quite a lot, and it's really nice to be able to do that. So please do just reach out to people.
Yeah, that's a really important point. And as I kind of said before, we can get so tunnel focused in terms of developing our application. We can forget to just try and have those kind of informal exchanges with people, try and make connections and talk about, you know, what things you need to consider. And networking really is a really valuable asset when it comes to putting a proposal together as well. But Reem?
I will concur with Adam, and I think from the room we were with, Joanne and Shan, I think one of the things that we benefited more is just talking their own ideas and their applications rather than the mock application, I think, for future, because that is exactly the encounter that will be useful, just talking to somebody who is either on the assessor board or an academic or whatever, but your idea and developing it, and start that conversation earlier on, because it may take you, it stops you wasting time going round in a loop when actually it may guide you from the beginning. So I do concur, and I usually, especially pharmacists, because we are all passionate in increasing research within pharmacy. So I think academics within pharmacy will be happy to support, even if you don't know them, and even sometimes actually if they're not going to be in your research team. So, you know, is they not to be supervisors? You'll be surprised that people will be happy to give their time to discuss your ideas.
Thank you, Reem. No, that's certainly true. Teresa?
Yes, I just wanted to talk briefly about a question that came up in our group, which I thought was interesting, regarding in the PPI questions about if 2 people are enough, or how many people make up enough PPI members. And it was just to say that you can't sort of exactly specify a minimum number to have, but just to advise people to try and get a group of people where you can get meaningful and diverse opinions. One of the members in our group was saying that they have a PPI group that's only got 2 people in it, but that's what those 2 people are happy with. So convey that. It's not to say you have to shoehorn in extra members just to seem to be sort of reaching loads and loads of people. It depends on the condition and the number of people that you might benefit and things like that. But if a small group works, and if that's what the members of the public want, then that's fine. Just explain that and try and secure a different range of voices or a diverse number of members if you can. Thank you.
Thank you, Teresa. And I think that point you raise links to a more important point of justifying why you've made certain decisions in your application. It's not about the numbers game or showing you've done this and that. It's just understanding the reason I've chose this method, or the reason I've chose these, invited these people to be involved in the research is because. So it shows that you've considered why you've structured your application in a certain way and what elements I'm how it's going to feed into your proposal overall. So it's showing that you've thought about it and that you made it clear to the panel that you've thought about it. That's even more important, because at the end of the day, initially what the panel are seeing is the application. So that's what your proposal is going to be based on. There is an interview stage, but only if your proposal meets a certain thresholds, if you're shortlisted. So you want to make sure as much as possible that it's in the application, that it's absolutely clear what it is you intend to do and why you intend to do it. Any other questions or feedback before we bring to a close? No, I may bring in, oh, Rachel.
Yeah, I just wanted to say that I found it really, really useful, and I think I'm coming at this from the point of being quite sort of early on in the thought process about applying perhaps to do a PhD, but it's quite daunting to be in that position. But this has really sort of demystified the process and made it actually feel quite achievable. So thank you very much for putting together a great session.
Thank you. I appreciate that. And yeah, it is daunting, especially with the application form and to say the least. There's a lot to think about as well. And that's why it's so important to have that support network around you. Well, as I said, that this recording will be available. So I'll circulate the link to you afterwards so you can revisit it. But having said that, please feel free as well to contact me if you have any questions about the PhD scheme or anything that we've raised in this webinar, and I'll be happy to either answer your questions or to signpost you to someone who can help. And I think, Guy, before we wrap up, was there anything else on your end before we brought this to a close?
No, I don't think so. Just to say, yeah, thanks very much to everyone, obviously, yes, for attending and participating. Hopefully it's been helpful, and thank you for, yes, all the panel members for your support and input, and obviously thank you to Desh, who does all of the hard work actually organising and pulling everything together. So yeah, no, it's been really interesting for me as well, just to hear about everyone's everyone's experiences and plans, and yeah, some of the things that we often find through our discussions at panel meetings. So yeah, really, really useful, and well done everyone. Thank you.
Thank you. Thank you all. Well, you have my email, so if there's any follow-up questions or anything like that, please let me know. Otherwise, enjoy the rest of your day, and thank you to our facilitators as well. Appreciate it.